Carole wants to know for promoting interoperability, the PDMP, the Prescription Drug Monitoring Program query, is now a requirement. However, our providers don't prescribe any controlled substances. We have thus far not enrolled in EPCS as we didn't need it and it was expensive through our EHR product. Our EHR vendor has told me that in order to be enrolled in the PDMP query, we must also enroll in EPCS. This seems very silly since our infectious diseases and Lipid Clinic physicians don't ever prescribe controlled substances. I have been unable to find an exclusion. Is there an exclusion that I've missed? Or do we have to spend the money for something we don't use just to stay compliant for promoting interoperability?
I think the news for you, Carol, is good. And this is a great question with about 6 components to the answer. 1, what is a PDMP query? 2, what is EPCS? 3, what does it take to pass the PDMP measure in the Promoting Interoperability Performance category? 4, what controlled substances are covered by the PDMP measure? 5, is there an applicable exclusion for this measure? And 6, how do I apply all of that to your specific situation? So first, what is the PDMP query? PDMP stands for Prescription Drug Monitoring Program. It's usually a statewide solution, and there's progress toward a national roll-up to these programs into one master program. Programs tend to require participation by pharmacies and recruit prescribing providers to use the service. At last tally, 49 states, the District of Columbia, and Guam have operational programs. Missouri is the final state to be working toward implementation and may be up by this time, but I haven't found specific reference to it yet. Just that they're working on it. The intention is when writing a prescription for controlled substance, the prescriber will check the PDMP for record of controlled substance prescriptions previously provided to the patient. The intention, of course, is to identify when a patient is acquiring controlled substances from multiple sources as a sign of abuse. Procedures for accessing the program can vary from state to state and can include phone inquiries, direct web-based login and query, integration directly between the PDMP and the EHR, integrations between the EHR and a national PDMP clearinghouse, and specific programs might accept logins from the prescribing provider or from the provider staff. Next, what is EPCS? EPCS stands for Electronic Prescribing of Controlled Substances. It's governed by both the DEA and by individual state boards of pharmacy. It requires appropriate DEA credentials to prescribe controlled substances. It requires proof of identity by some authority that can vary from region to region. It's kind of like proving your identity for a passport or for the newest real ID driver's licenses. And it requires two-factor authentication when you write prescriptions to electronically sign the prescription. So what are the requirements of the measure? The measure is addressed as an attestation. You answer to the question, has the required action been performed at least once by the individual provider or by at least one provider in the group? Yes or no? The required action is to query the local PDMP to access the patient's history when prescribing a controlled substance. Now, the rule states a MIPS-eligible clinician has the flexibility to query the PDMP using data from the EHR in any manner allowed under the state law, meaning it does not have to be integrated with the EHR. It doesn't have to be automated unless that is the only way your local program permits query. It does not require credentials for EPCS. It's applicable to electronic or manually written prescriptions. Now, what controlled substances are covered by the PDMP measure? This changed for the 2023 submission year. Prior to 2023, it only applied to the Schedule II drugs. Starting in 2023, it adds Schedules 3 and 4 drugs to the list. Now, don't view this as being more restrictive. It's actually more lenient. Since it only requires one query in the year in order to pass, you can now pass by querying for a Schedule 3 or 4 drug if if you don't prescribe Schedule 2 drugs. Now, the next question is there an exclusion that you can use or I can use in my practice in which I do not prescribe controlled substances? There are three exclusions that apply to the PDMP measure. One, if you're unable to electronically prescribe Schedule 2 opioids and Schedule 3 and 4 drugs in accordance with the applicable law during the performance period. Two, you're excluded if you write fewer than 100 prescriptions during the performance period. Three, if querying a PDMP would impose an excessive workflow or cost burden prior to the start of the performance period. Now, how can we apply all of this to your specific situation? We know that you have a specialty practice dealing with infectious disease and as a lipid clinic. You have an EHR. You electronically prescribe, but you don't prescribe Schedule 2 drugs. What do? Well, first, you do not need to implement electronic prescription of controlled substances. You don't prescribe them. It's a waste of time and money. You don't need to be electronically interoperable with your physician or your patient drug monitoring program, even if you prescribe controlled substances. The key phrase in the rules is you can query the PDMP in any manner allowed under state law. If your local PDMP permits you to log in through the internet and manually search the database, that qualifies. You have to interface if that is the only way your PDMP permits query. You only need to do it once to pass the measure, and only one of you needs to do it once. You can't just check the PDMP on your prescription for a non-scheduled drug. The specifications are specific to scheduled drugs. But don't think only about Schedule 2 drugs. Starting in 2023, you can query your Schedule 3 and 4 drugs as well. If any provider in your group prescribes a Schedule 3 or 4 drug and logs into your local PDMP to check the drug history on that patient, you can attest yes to this measure. Now, if you still can't pass this measure on a Schedule 3 or 4 drug, you can use one of the exclusions. You probably can't use the fewer than 100 prescriptions exclusion. It applies to all scripts, not just controlled substances. The 100 scripts is not an annual number. It is counted only for the selected performance period, which can be short as 90 days. Now, I like the unable to electronically prescribe exclusion for you. If you consider my scope of practice doesn't give me the opportunity to prescribe controlled substances, I think it fits reasonably well. But equally applicable is the excessive workflow or cost burden exclusion. Certainly, it's excessive to spend anything on functionality you don't need and won't use. So, thank you very much for that question. I hope I've helped. Good luck to you in this application.